And Alan and Naomi, they run a clinic together in the Gold Coast. And Naomi, she's also a student of traditional Japanese acupuncture. So the purpose of these webinars is mainly to traditional Chinese medicine practitioners that want to make the bridge to the understanding of traditional Japanese acupuncture. Of course, it's open to everyone that wants to learn more, but it's mainly giving the basics so people can understand better. So I ask everyone to mute their sound. You can leave your video on and please make your questions at the end of the talk through the chat. And now I'll pass it to Naomi and to Alan.
Maria. Alan, do you want to say anything before I start asking lots of questions?
I'd like to welcome each and every one of you. I'll make a special mention here. I've just noticed there's an archaic student of mine just come up on the screen who I haven't seen in person for many, many years, who used to fly a long, long way every, I think once a month for many years to come and work in clinic. So welcome, Donald Cameron. And to everybody else from all parts of the world, it's a very special privilege for me to be able to be here and chat, as it's been a real privilege for me to work with Ikeda Sensei to the best of my ability to advance my skills, my understanding of traditional East Asian medicine. I'd like to recognise Ikeda Sensei's role in that, Edward Obeidy Sensei's original role in instigating the connection between Ikeda Sensei and myself, and also the role of Takashi Fure in his efforts in translating many of Ikeda Sensei's texts. It's really special to be able to connect with so many inspired people throughout the globe. So I'm going to bounce the ball back to Naomi, but just before I do, I'm going to gong us in. Far away, Naomi.
Thank you. So Alan Sensei, up to now, we've done a series of talks exploring what actually happens in the root treatment. So we've been discussing the classical context and theoretical basis of diagnosis and pathology for the root treatment, and then the physical application of that theory coming through aspects such as needling, pulsating. So the natural next step to fully understand the process of the root treatment was Hara diagnosis. So could you please explain for us, when is Hara diagnosis applied during the root treatment?
Thank you, Naomi. It's an interesting question. I actually pondered it quite a bit just to understand the logistics and to why, if you like, into traditional Japanese medicine, there's much import placed on the Hara diagnosis or abdominal diagnosis, as distinct from the TCM, where great import is placed on tongue diagnosis. So I think they're complementary. The logic that I got out of my thought is that the Japanese approach tends to be very tactile. This may be as a result of the blind practitioners being given preference a couple of centuries ago as a result of the discovery of their sensitivity. Whilst they may have lost their sight ability, as a result of that, their tactile sensitivity increased extraordinarily. Hence, the guide tube that we use in the practice of traditional Japanese acupuncture was developed by a blind practitioner. And I would not be surprised to find out that the Hara diagnosis was also developed to some degree in relationship to the many people that were practicing that were sight compromised. Because of the emphasis on tactile sensitivity, we're feeling for all sorts of feel for dampness, we feel unusual tightness, we're feeling for heat, we're feeling for modules and nodules, we're looking at the location of the heat or of the extraordinary sensation over the abdomen. So again, it's very much about the fingertips, as is pulse diagnosis, and very much so in the application of treatment using acupuncture and palpating the meridians in traditional Japanese medicine. So that's kind of the underpinning direction of Hara diagnosis, and very much used in the practice of herbal medicine in Japan, the Kampo. I had the privilege many years ago of having access to Ikeda Sensei's library very early on in the piece, last century. Sounds funny, huh? But yeah, last century. And there was a magnificent 2-volume text on herbal medicine and the diagnostics in herbal medicine and the progressive changes that occurred in patients who were being treated by Ikeda Sensei and his elder brother Takio Sensei. The extraordinary thing about this book, and the beautiful thing for me, is that there were illustrations. I love illustrations. Illustrations are easy for me to read, much easier than kanji. So I was able to examine these 2 volumes, and they were serious books. They were bordering on encyclopedic size, and they were double volumes, but in each of the different case histories, they would case history one certain herbal formula and then would track the abdominal pattern as the patient underwent treatment from, say, for a week, and then there'd be another check of the abdominal pattern in maybe 2-3 weeks. This is certainly made up, in addition to the pulse and of course the patient's condition and symptoms, it made up a very important part of the changes that were occurring as a response to the treatment. And it also enlightened me as to the fact that how important Hara diagnosis was in the practice of traditional Japanese medicine, especially. Suffice to say that in the main, Hara diagnosis is used in the diagnosis of chronic conditions as distinct from acute conditions. So, I mean, someone with the flu, with a fever, then they're going to feel hot. If they feel cold, we have a real problem. And that can happen. Of course, the fever can be internal and the outside can be chilled. But we're not talking about that at the moment. What we are emphasizing is that primarily for acute conditions, we're using the pulse and the symptomology to diagnose the patient, and the etiology and history, of course. And then in the acute conditions, more so we're using the palpation of the abdomen when we can't. I use the abdomen in the initial treatment on most occasions. And certainly if I have any doubt about my diagnosis or where I should be moving, I definitely use the palpation of the abdomen as a way of defining the process and gaining a clearer idea of what's happening for that particular patient.
So from a logistical perspective, throughout the process of the root treatment, you're using it obviously as part of the diagnosis. So it's part of your root treatment process.
Absolutely. And at the beginning, and especially in that initial treatment, one of the things that I do in clinic, and very little of what I do is original, actually nothing. Everything is plagiarized from Ikeda Sensei, Edward Abadia Sensei, who have unashamedly plagiarized from the classics. This is our lineage. We put our own personal imprint on the classical principles in action in clinic. So certainly I mirror, to the best of my ability, Ikeda Sensei's propensity to use the Hara diagnosis to gain a clearer idea at that initial stage. It confirms, it's very important to have a warm hand, and I spend very little time questioning the patient. The patient answers a series of questions on their clinic record form before they come into the clinic or into the actual treatment room. In the treatment room, they change and they're covered by the towels, and in this instance, paper towels as well, and all the other rigmarole that is required in this day and age. But by talking to the patient with an understanding, a pre-understanding of what's happening for them, then I'm able to confirm whilst I'm taking the pulse. And I'm introducing myself to the new patient with touch. So I'm palpating, well, that was good. I'm palpating the radial artery for the pulse. And they know that my attention is really focused on them in a way other than just interrogating them about their symptomology. And the same is apparent explaining to the patient, this is what I'm doing now, and this is part of the diagnostic process. Certainly when I was a young boy, and then that was a while ago, my doctor palpated my abdomen. He would test my forehead. He would actually look at my ears. He would check all parts of the body with his hands. And his hands, I remember as a child, oh, that feels really, it felt good. It felt nice, and it felt very reassuring that this medical practitioner, as a young boy, felt like he really cared for me. And thank you. He really cared for me and was looking out for my best interest. And this is the sense that I like to carry through to a treatment. So I'm talking to the patient, they're laid down, they're comfortable. I'm doing my best to make them comfortable. I'm listening to what they're saying. I'm listening to how they're saying it. I'm smelling them. I'm looking at them, and I'm touching them all at the same time. So that's a very powerful combination of focus on an individual. So we get an idea of the tendency and the pattern of disharmony that's occurring with the patient, but it's a very individual diagnosis. We're not schematically trying to throw the patient as a disease state. More we're trying to understand is is it hot here? Do we feel heat up in the chest? Is the throat sore, swollen? Have we got any pain in the costal cartilages here underneath the rib cage? We're basically moving our hands over the anterior aspect of the body, searching for anomalies at the beginning of the treatment. And just, sorry, Naomi.
Yeah, go ahead.
Sorry. This we do usually at the beginning of the treatment. It is not common for the abdomen to respond spontaneously as the pulse. So we're looking for gradual changes. This is why it's so, the herbal medicine or Campo component is so aligned with the Hara diagnosis, because the person will go away with the formula and they come back in 2 weeks or 3 weeks' time, depending on the condition, or could be 1 week. But at that time they come back and can check the abdomen for the change, because it will take time for the abdomen, the characteristics of the abdomen change as treatment progresses. It's not a spontaneous response, as is the pulse.
So one more point of clarification, Alan Sensei, do you use abdominal diagnosis before or after taking the pulse in your root treatment?
Oh, clever, Naomi. I would say in 90%, at least 90%, actually probably closer to 95% of the cases, I definitely take the pulse first. Now, if the pulse is not clear, then it's quite possible that I might do some light palpation of the abdomen, and I may even use the 4 stomach points, stomach 25, the CV12 and CV4, conception vessel 4, conception vessel 12, and stomach 25, and leave them in place. But essentially speaking, I'll take the pulse first. That'll be my first move, because I'm actually present in eye contact with the patient, and I'm talking to them as I'm taking the pulse. So I'm I know it sounds strange, I'm listening with my fingertips. And then if there is discrepancy, a marked discrepancy, then I could immediately refer to abdominal diagnosis. My priority diagnostically is the pulse, but one of the diagnostic backup tools I have to confirm the accuracy of my diagnosis is the HaraAbdominal Diagnosis.
Thank you so much. That was very clear. And I was just wondering, before we move into a little bit more about the information that's being gathered during Hara diagnosis and palpation, is there anything else that you wanted to cover in respect to the historical context that we're using with Hara diagnosis?
Not really. I've actually got a quote. I think I used it last week a little bit, but I want to use it again. And this is from the introduction by the translator of this particular book. Excuse me, getting this organized. That must work. Yep. The Mai Jing. Now, this is the Pulse Classic, but again, this reflects the importance of the process, and it is a process. In the beginning, it may be difficult to understand what this textbook really wishes to convey, but by reading it over and over, and we can substitute that by palpating over and over, by using our hands as well as our brains, the skill of the practitioner improves. It will be revealed as if the mist clears. Thus, it is important not to give up following the world of the Mai Jing, which is the Pulse Classics. You can read into that also abdominal diagnosis and traditional medicine, but to keep going at a very slow speed, and even if the road is not flat. That very much the back screen reflects that particular journey I've referred to before. Because, and this is the important part, and this really soaked into my tissues a couple of years ago when I was preparing for Ikuta Sensei's workshop here in Australia, and I was proofreading the handbook for the workshop. Because you are part of the river's flow, which has been in motion since ancient times. It will push you forward gently unless you intentionally stop yourself. So that means if you continue to study and you continue to work with your skills and develop your skills, you will invariably grow, exponentially grow, actually, as a practitioner, and your clinical outcomes will be affected as such. That's my referral from the classics now.
Thank you so much. Really enjoy that. I could hear that every day. Could you now talk a little bit more? You did cover this already in your introduction, but is there further detail that you would like to share with us about what information specifically, not so much how to use it diagnostically, because we don't have time to talk about that, unfortunately, but just what kind of information are you gathering when you are palpating the abdomen during the root treatment?
There's much more than this simple diagram. Hara diagnosis is, as any other diagnostic process in traditional East Asian medicine, is complex. Certainly not belittling tongue diagnosis, by the way, but it is as complex in its way as a tongue diagnosis. But we're looking for, first off, we're laying our hands, the palm of our hands, on the abdomen in a gentle way. We want to make sure our hands are as warm as possible. We don't want to go slap our hands after we've pulled them out of the fridge on the patient's abdomen. We know what will happen. We know what would happen if someone slapped a cold hand on our belly when we were laying there feeling a little bit vulnerable. Yeah, it would be a very tightening and tensing, not a comfortable experience. So it's important to approach palpation, the Hara diagnosis, not only as a diagnostic process, but as a therapeutic process. The way we palpate the abdomen is quite important. And it's certainly a lesson that I continue to learn. I profess no huge expertise in this area. Yes, sometimes I am definitely the bull in the china shop. I think Ikeda Sensei has been trying to get that message across to me for many years. But it's a matter of going in a very gentle way, laying the palm of the hand and then moving the hand around the actual abdominal cavity, examining the costal, underneath the costal area where the liver is, and then over to where the spleen and the pancreas is. Then we have the epigastrum in the middle of the abdomen. We're looking, is that tight? Oh, look, it's a bit damp, or is it dry, or any sort of skin lesion in the area? Is there any lumps or bumps? And this is very much the case for women having a uterus as well, naturally. Then the propensity, when we're performing Hara diagnosis, there's a lot more information coming in that regard, especially when we relate it to the different patterns that women tend to be sensitive to or prone to as a result of birthing and growing children inside themselves. A bit tricky. And the menstrual period, of course. So in the chest, we're including the chest as part of the abdomen as well. Primarily up here, we're feeling for heat. And when we're looking also, we can look visually, and often you'll see in this area here in the throat and then upper part here and underneath the clavicle will be quite red. And that would generally be associated with a yin deficient pattern of some sort, being that the cooling factor, primarily the liver and the kidney, is deficient. So this allows the yang energy to rise up in an uncoordinated fashion. And it can cause issues here. It can cause sore throats, rashes, and anxiety, of course, can be part and parcel of that scenario where we have heat lodging in up through this area. If we could throw over to another slide, please, Maria. Great job. Thank you. So here we have 3 patterns. I cannot teach you the Hara in 35 minutes. Not possible, but just wanting to give you some examples of the uniqueness of the patterns. And this by no means is this the full extent of the patterns, but just give you a bit of an idea. And the first of the patterns, you'll see it reads liver deficiency heat pattern. That actually, in this instance, we're talking about liver deficiency, yin deficiency heat pattern. And this can be constitution. This is not necessarily a disease state. A person of a liver deficient constitution will tend a little bit this way. As with all of the patterns, the constitution of the person is relative to the pattern that's appearing. I'll just quickly refer to, say, a person with this particular pattern, the liver deficiency heat pattern, that perhaps is their normal constitution. If they were, through misfortune, to develop a spleen deficiency liver excess heat pattern, which is one of the disease states that would fit into that syndrome pattern, is hepatitis. So in an acute form, so their abdomen after the hepatitis would present quite differently to their original constitutional pattern. So again, it's we have this, we learn to develop an ability to recognize the constitution of the patient, and if there has been any sort of severe illness, the possibility of there being a change in the abdominal pattern they present with. So here in the liver deficiency heat pattern, the shading we have in the upper part up here in the chest is heat. The X's in the chest and down on the pubic symphysis, pain and discomfort, not necessarily a coagulated area, but just uncomfortable. And that funny looking fan on the left-hand side of the abdomen, the right as we look at it, but the left-hand side of the abdomen, that's tightness. So that's the basic liver deficiency, yin deficiency, heat pattern. Then adjacent to that, we have the spleen deficiency, stomach deficiency, heat pattern. Without going into the pattern in depth, again, we're looking at the discomfort up here in there. It's basically the lung 1, lung 2 area. That means there's a bit of heat has moved into the lung or the lung meridian as a result of this pattern. Then we have the the tightness and distension in the epigastrum, with the pain and discomfort around this conception vessel 12 area. Again, we have a tightness, significant tightness there bilaterally, either side of the epigastrium, and there's a tightness and discomfort actually in the umbilicus as well. We can have that pain, just a primary painful area there on the left side of the abdomen, not quite down on the pubic symphysis, but a little bit higher. Again, this is not a matter of teaching you each and every individual pattern this morning or today or this evening or tonight. This is just giving you examples to understand that there is another way of supporting our diagnostic process. And then the last but not least is the spleen deficiency heat pattern, which I would relabel I would relabel it as spleen deficiency blood stagnation pattern. That conglomeration, that very dense cloud, if you like, below the navel is actual blood stagnation. That will primarily occur in the uterus for women, but not exclusively, but that's the tendency because it's related to the blood, and the uterus is primarily dealing with the production and the of blood, or the storing of the blood and the reproductive cycle and refreshing the processes on a monthly basis. Again, you see with the shading, the right side will tend to be tighter than the left side in this case. And there will be a tendency to tightness again in the epigastric area. But again, this is demonstrated because it's slightly misnomer. It's not really spleen deficiency heat pattern. It's spleen deficiency blood stagnation. So there's not so much heat involved as you can see in the spleen deficiency, stomach deficiency heat pattern, where there's soreness and tenderness up here. In the liver deficiency pattern, there's a lot of heat rising up. And we'll do the last slide, perhaps, Maria. Okay. Again, this is by no means the extent of the patterns, and certainly in the Campo medicine there are a lot, far more patterns. But it's a matter of getting the basics under control first, particularly in the practice of acupuncture. Probably more important in the herbal medicine to have the totally comprehensive diagnostic capacity with the abdomen, but that requires many years of study, and also I believe the mentorship of someone who's very expert in that area. So here we have the lung deficiency, liver excess. This is actually another blood stagnation pattern. You'll notice in both of the blood stagnation patterns that the tightness has tended to be on the right-hand side. This is related to the liver function and how it interacts with the rest of the abdomen. You'll see that there can be blood stagnation again in the lower abdomen. That can take the shape of prostate problems with men, bladder issues. One of the ways this can develop is through the kidney deficiency pattern, which will eventually lead to a blood stagnation in conjunction with the liver deficiency pattern. The crosses on the pubic symphysis, of course, again, represent pain and discomfort. You will, when you start to practice and study, when I say study, study with your hands, and experiment and explore, then you will start to discover that there are, in fact, a number of different patterns and with general tendencies. And then the last but not least is the kidney deficiency heat pattern. This is where the heat will express out and can cause disruption in the lower jiao, particularly with the bladder and the prostate for men, and it can to some degree with uterine function with women, but not so much. It's more the bladder or UTIs, that type of thing. In many cases can be a result of this particular pattern, and we will feel the heat and the discomfort and the tightness in the lower abdomen. And it can, in some instances, we can have these pockets of heat exist up around the conception vessel 17 area, meaning that the kidney deficiency is quite significant. And the deficient heat as a result of the yin deficiency is disturbing the harmony of the upper jiao. And as we probably all know, kidney deficiency can also cause anxiety and palpitations. And that is a result of what we call the deficient heat affecting the function of the heart.
Thank you, Alan Sensei. That was really inspiring, just getting that window into the kind of data that you're collecting during Hara diagnosis. And it's probably, I hope, inspiring for any practitioners that didn't get a chance to cover abdominal diagnosis in their training, or perhaps student practitioners who haven't yet gotten to explore that. And perhaps we will all start touching patients' abdomens more frequently to start getting some introduction to that information. And for novice practitioners of abdominal diagnosis, do you have any sort of guidance for any tips or ways to get started introducing this into our treatment process?
The single most important factor is warm hands. That's absolutely, that's vital. There's no point in putting a cold hand on a patient's abdomen. That is just, that's the biggest tip. The second one is that we use the entire hand. We use the palm of the hand, and we're basically connecting with the patient. So our awareness needs to be on their abdomen. And where it's again, it's the same process as the pulse. It's like acquiring kilometers of experience. We need to put the clicks into the fingertips and the palm of the hand. So the same story is with the pulse. We need to start. As far as the study of the Hara, we have some video material on worldacupuncture.com covering that area. There's also a textbook that is available that does cover the Hara diagnosis to some degree. Maria might like to show you that one at the conclusion of the webinar. That is available. That one will be available through Amazon.com, I would think. There is a shortage of information in the West on Hara diagnosis. Of qualified information. There's no doubt, make no doubt, that you need to keep an open mind and just search. Just compare your findings with the pulse, with the symptoms, and be part of the river. Just be slow and be very, very gentle with yourself, and as least judgmental as you possibly can be as you move through the process. Because the harder we are on ourselves, the less, my experience, and from my experience, the less attention, less energy we've got for our patients.
Thank you, Alan Sensei. That was very beautifully put. Is there, before we start asking for questions, is there any outstanding clinical examples or anything you've come across in treatment of patients that you just wanted to share with us in relation to Hara diagnosis?
I think it's a difficult one because each different country, there'll tend to be a slightly different pattern because we're constitutionally not all the same. So anything they say is really a generalization, and it is a result of my clinical experience in Australia. But I'm certainly finding as time goes by, especially in the 21st century, the prevalence of liver deficiency abdominal pattern is becoming far higher. And I think people constitutionally are moving more towards that pattern, certainly in our culture. I'm not so sure about Japan or the Asian nations, and I can't speak for European or South American or North American patterns. So I'm sure there are similarities, but certainly that tendency towards the tightness on the left-hand side of the abdomen is far more prevalent. I think when you're feeling the abdomen, the left-right balance is very important. Another area that I use quite a bit is inguinal groove, the anterior aspect of the hip, and from gallbladder 26 down to gallbladder 28. Find that area extremely important in understanding the left-right balance. And then that leads naturally to the tightness on either the right side or the left side of the abdomen. So if there is a distinct tightness either side, then that gives us a very strong indication of where to head. So that'd be the key factors. The rest is in the developing the sensitivity, and again, using all of our senses, and certainly in the practice of traditional East Asian medicine in Japan, the tactile skills are extremely important factor in diagnosis. And the beautiful thing about the tactile skills is using the hands, then we develop our sensitivity. We grow as a result of that. If we're just using a technological device, then our ability to grow as an organism, as a human diagnostic machine, is limited by our use of the technology. It doesn't make technology wrong, but it doesn't add to our encyclopedic understanding as a human of another human. And I think that is such a key to the traditional medicine. It's human to human medicine. And therein lies an exponential growth pathway.
Thank you so much. I'm through with my questions that I had prepared, so I'm just going to hand over to Maria to direct any questions that may have come in from people listening today. Thanks, Maria.
Thank you, Naomi. Thank you, Alan Sensei, for the very good answers to their questions, Naomi. So if anyone wants to make any questions, please write them in the chat and I will read them to Alan. Actually, I just had one here from Ailey while you were talking, because you were talking about having warm hands, and she was saying she's a very chilly person. So do you have any tips how she can get her hands warmer?
Yeah, okay. Firstly, breathing is important. So if we're able to do light abdominal breathing, I'm not talking about super deep breathing, excuse me, then that goes a long way. Obviously, movement and friction. And this can be really challenging. I know that Naomi uses the microwave on the wheat bag. So if you have a microwave and you have a wheat bag, you can throw the wheat bag in the microwave and then grab the wheat bag when it comes out. Please don't put your hands in the microwave. Bad joke. Sorry, dad joke. Can't help that one. Actually, of course, movement. And then actually this is a really sweet way to get the blood circulating. Can you see that I'm not rigid there? I'm doing everything I can to flick my fingers from my shoulder. So I'm using the wrist as little as possible, and I'm encouraging the communication between the shoulder and the fingertips. If you were to stand in that way with your hands by your side and spend a couple of minutes doing that, then come in with this one, that works terrifically. If you need to use an artificial means to warm your hands, by all means do. We have this one, it's an old one, depending on your odor situation, you may or may not choose to do that. But they're the basic methodologies of warming the hands. It's actual physical movement. especially the loose wrist one. That is just lovely. That just helps bringing the chi down, especially if we're doing both those exercises with a very relaxed lower abdominal breathing, which is a key to, well, in my opinion, it's probably the primary key to good health.
Thank you. We have here another question from Claudio. It says, Sensei Alan, I would like to know what is the meaning of the strong abdominal aortic pulsation? Is it related only to kidney deficiency pattern? Or also in stomach excess, we can feel this pulsation? Thank you.
Claudio, it depends on where the palpation is, and it does vary. Certainly, pulsation either side of the conception vessel in the lower part of the abdomen will tend to reflect the kidney deficiency. There are times when we actually feel the pulsation more so to the left-hand side of the abdomen. In this case, that will primarily reflect liver deficiency. And then certainly when we are palpating the epigastrium, if there's a very strong pulse there, then it's a little bit difficult to distinguish it, but quite commonly it will be stomach. There'll be heat in the stomach, and that could be a result of kidney deficiency, liver deficiency, or spleen deficiencies, but mainly kidney and liver deficiency. But it will when it occurs in the epigastrium, then we're looking directly at spleen deficiency. That would normally be our primary syndrome pattern for that issue.
Thank you, Alan. We don't have here at the moment any more questions. Maybe, oh, there's another one. Claudio wants to ask another one.
Of course he does.
I would like to ask a second question. Where is located the lungs in the abdomen? Does it show changes for acute respiratory disease? Okay, where is located the lungs in the abdomen?
Abdominal diagnosis, yeah.
Yeah, and does it show changes for acute respiratory disease?
Okay. I mean, obviously we have the lungs themselves, but the area, the palpation, the area for the lung is here, up here, lung 1, lung 2 area. Of all of the conditions, this is the one that might tend to reflect acute conditions more so. Yes and no. It can show up both in acute and in chronic conditions. It can also reflect the condition of the meridian or the organ or both. So that area is because, but primarily it'll reflect chronicity rather than acute. So as far as acute symptomology and confirming what's happening there, of course we're palpating to feel the heat in this area here, in the CV17 area, but we're using the pulse very much in the diagnosis of the acute conditions. That's my priority lies there. Whilst not saying I'm not saying there's no relevance in the abdominal pattern, but the primary relevance will be in the pulse rather than in the pulse pattern. But as far as lung disharmonies go, they will be reflected in the lung 1, lung 2 area here.
Thank you, Alan. Okay, so there's another question coming. What is the correspondence of the Mu alarm points to Hara diagnosis? From Joaquin.
Good question. Well, if we look at the Mu points, liver 14, well, that's physically over the liver. With Hara diagnosis, when we're palpating the heat, and we can palpate the discomfort on the Mu points. The Mu points are interrelated with the general abdominal patterns. So we're looking at the same time as we're examining the patterns per se overall, we're also checking the front move points. And it's no accident that, Claudio, that this would happen to be the front move point for the lung. And then we have the front move point for the pericardium. Again, you will see those points have been brought up in the Hara diagnosis. We have the front move point for the gallbladder being close to the liver, and that hypochondria area just below the costal cartilages. So the front move point for the stomach, CV12. I think the only one where there's a little bit of discrepancy would be liver 13, the front move point for the spleen. That tends, the spleen itself is on the left-hand side of the abdomen. And also that was one that primarily, when we palpate it when we're examining the abdomen, that was one that will reflect disharmony of the liver and spleen. So I guess the point is on the liver meridian, liver 13, but it is indicative of spleen disharmony. So it's telling us the relationship between the liver and the spleen is compromised. So yeah, by all means, the front move points are very important, as are the back shoot points. And we're not integrating that in today's presentation, but yeah, you definitely acknowledge and utilize their sensitivity in conjunction with the overall Hara diagnosis.
Thank you, Alan. There's just another question coming from Yukio. In Japan, is there also a massage therapy like the Tuina traditional of Chinese medicine? In Japan, it's called Anma.
Yes, yes. There are a number of different massage modalities. Anma is one, and a very key one, and used often in conjunction. Well, certainly it's a popular form there. Shiatsu, of course, but Anma's, again, I find it's about the focus and the delivery. It's not a winner's take all. It's not about smashing the body. Again, the Anma is performed in a specific and very focused fashion. I'm no expert in Anma, but yes, there is an Anma massage, and that would be the equivalent of gua sha, etc.
Thank you, Alan. So I think maybe we close the questions if anyone just wants to make a quick question, otherwise we'll close it for this webinar. Maybe I just talk a little bit of the resources we can share with you through World Acupuncture. Some of you might know the website, but if you don't know, it's a platform that has several resources. So one of them, it has a shop with the books translated into English by Ikeda Sensei. And we have also some video seminar with the CPD points if anyone needs that resource. And also using the website as an online learning platform. It has more than 200 videos with Alan Sensei over the last 15 years explaining, giving live treatments with diagnosis, explaining the theoretical behind the diagnosis, and also with all the skills involved in delivering the treatments. And also you can have tutoring directly with Alan Jansson Sensei. You can approach him directly at Alan@World Acupuncture. And you can also contact me if you have any questions through Maria@World Acupuncture. And now I just pass it to Alan and Naomi to finish the session.
Next week, we'll be doing our concluding session for the series exploring the root treatment. So for next week's session, Alan has kindly offered to do a root treatment on a patient to actually put all of these steps together in practice, in action for us to observe and sort of have a comprehensive, real working understanding of how it looks in a clinical context. So thank you for that, and lovely to see everyone here.
But it's a real privilege, and I thank each and every one of you for coming along. I've been very, very fortunate in my journey with traditional East Asian medicine, and the entire purpose of this series of webinars, and in fact the worldacupuncture.com website, is to share in the benefits of this this lineage. And the lineage is from the ancient texts, so it's extremely congruent with actual traditional Chinese medicine. In fact, there are many aspects of the practice of traditional Japanese acupuncture that are extremely aligned, with actually all factors extremely aligned with the Lingshu, the Nanxing, Shanhan Lun, etc. So this, if you like, it's classical medicine. It's the traditional Chinese theories and expertise and brilliance being delivered in a very sensitive, articulate, and tactile manner. So we're using the intellect, but most importantly, we're using our hands. And the more we use our hands in the treatment, then the more experience we gain, tactile kilometers we get in our fingertips. And to my mind, that is the single most important feature here in differentiating between the two types, if you like, the main types, the TCM and traditional Japanese acupuncture. As I've explained, there's lots of mix and matches, and nothing's bad, nothing's wrong, but there are different approaches. And I love the idea of aggregating my experience through my fingertips. And I would like to wish you all in your respective areas, regardless of what the heck's going on outside, I wish you all the best of health.
Bye-bye, everyone.
Chao, María. Muchas gracias. Bye,
De
bye.
nada. Chao, chao.
Chao, chao.
Thank you.